I'm joined today by Professor Steve Powis, the National Medical Director of NHS England, and General Sir Gordon Messenger, the Head of Operations for the Community Testing Programme. Tomorrow night, our national restrictions in England will come to an end. And subject to the vote in Parliament, we'll return to the tiered system from Wednesday morning. I know that the national restrictions have been really tough for some people. But the good news is they've been working. Let me take a moment, if I may, to run through some of the numbers. Today's study from Imperial College shows that the national restrictions have brought down cases by a third. Over the last week, the average number of positive tests is now 14,778, down from a peak of 25,331 on the 16th of November. Today, there are 15,712 patients in hospital right across the UK with coronavirus. That is down from 16,612 on the 23rd of November, a week ago. In England, in the week before the peak, the number of cases grew by 11%, but in the last week, cases have dropped by 30%, almost a third. This is clearly good news. It shows that the national restrictions have been successful. And what this means in practice is that through everyone's actions in respecting the national lockdown and through everything that people have sacrificed, we've reduced pressures on the NHS, we've brought down the number of coronavirus cases, we've got this virus back under control. And I want to thank you for that, and for the part that you've played. The effect of the action that we take, of course, brings with it huge challenges too, especially for the hospitality sector. And as the analysis of health, economic and social effects of COVID-19 and the approach to tiering shows, which we've published today, it clearly demonstrates this action is necessary to avoid a much worse outcome. And we must be vigilant. There are still 14,778 positive cases reported every day, and there are still those 15,712 people in hospital with COVID. And sadly, there are still 460 reported deaths on average each day. This is far too many. But there is light at the end of the tunnel. We know that together we can beat this, and we've got to stick at it. Putting this in technical terms, the R rate is back below 1, but only just. When R is below 1, the number of infections falls over time because, on average, each infected person infects fewer than one other. And for that to happen on average, it's important that lots of infected people infect no one else at all. This is the central challenge of this pandemic, and it's made much, much more difficult because about 1 in 3 people with coronavirus have no symptoms at all, but nevertheless they pass the infection on to others. And that is why, even as we ease these national restrictions, we've got to keep some restrictions in place, and hence the tiering system. So while we can let up a little, we can't afford to let up a lot. The success of our collective efforts means that from Wednesday, everyone in England, even those in Tier 3, can have some greater freedoms. But we don't have much headroom. We can't risk letting cases rise again, especially into Christmas and with the flu season round the corner. The Prime Minister has published the government's COVID winter plan, which sets out the end to national restrictions and the steps that we'll take to help to bring life back to normal by spring. But even as we take those steps forward, we must keep our resolve. We've worked so hard and collectively sacrificed so much. But we can get through this, and I know that hope is on the horizon. In the past fortnight, we've made some really significant progress on vaccines. And the NHS now stands ready to deploy a vaccine should one be approved by the UK's independent regulator. Today, Moderna, the American company, formally filed for its vaccine in America. Moderna has already been submitting data to the MHRA, the UK's regulator, for some time. And as we set out this weekend, we've secured 2 million further doses, meaning that we in the UK now have access to a total of 357 million doses of 7 different vaccines. And while we keep working on a vaccine, we've already built a huge testing capacity that we can deploy right now. And I wanted to take a moment to talk through the next steps on testing. Since the start of the pandemic, we've built the biggest testing capacity in Europe. And it means we can use tests to do lots of things that we couldn't do before. In addition to our symptomatic testing programme and the rapid testing that we're now deploying in the NHS and across social care, we have the capacity to do more. Today, we begin the rollout of our university student testing programme and expand community testing. And we won't just test people with symptoms. Because of this problem of asymptomatic transmission, people who don't have symptoms but do have COVID, transmitting COVID to others, we're going to test people who don't have symptoms as well. This really matters because by finding the positives, we can break the chain of transmission and stop other people catching COVID. In Liverpool, where over 300,000 people, both those with symptoms and those without, where that testing has happened, they've managed to bring the case rates down by over 3/4. And so on Wednesday, Liverpool will go into Tier 2, not Tier 3. Of course, I want to see this sort of success right across the board. So we're rolling out community testing much more widely. We've been working with those going into Tier 3 with colleagues from Scotland, Wales and Northern Ireland too. And today, with the publication of our community testing prospectus, we set out the next phase of that work to give Tier 3 areas a faster way out of the toughest restrictions, to support them to come down the tiers as has happened in Liverpool. We've already received significant interest from around the country, including from the West Midlands, Redcar, Warwickshire and Medway and others. And this offer is available all across the UK and will be delivered in partnership with local authorities in Tier 3 areas and with devolved administrations throughout the country. Because by using tests that can turn results around in under 30 minutes, we can and then isolate people who have COVID, including, crucially, the about 1 in 3 people who don't have those symptoms at all, but can nevertheless pass the infection on. Because if you have COVID without symptoms and still infect others, that of course is silent danger. You wouldn't know that you're risking lives around you. And so to anybody, if you're offered a test, please take it, save a life. The final thing I wanted to say is that it is a responsibility to keep ourselves safe, to keep our families and our communities safe. That responsibility is on all of us. And I know that it weighs heavily, carrying it for a long time now. But the light of dawn is on the horizon. It's the moment to stand firm until the morning. So we can look back and see clearly that everything we gave and everything we did, it was not for nothing, but so we lives and build back better for everyone. I now want to turn to Professor Powis to take us through the latest numbers on the impact on the NHS.
Thank you. Today I'm going to present just a single slide. It's an update of a slide that I've shown before, which COVID-19 hospital inpatients in England. And as you all know, as infection rates rise, so do, unfortunately, do hospital admissions for those who are sickest. And of course, in a minority of people also that requires treatment in our intensive care units. And as I've shown you before, as infection rates have risen during the autumn from September through October into November, then usually with a couple of weeks lag, we start to see rises in hospital admissions and the number of people in hospital. And you can see in this chart that going through the autumn into November, we have seen increased numbers of people in our hospitals in England. Now, the national lockdown was introduced at the beginning of November, and we would expect it would be a couple of weeks, as I've said, before we begin to see the effects of that on hospitalisations. As the Secretary of State has said, we have the evidence that infection rates are now falling and have been falling during this period of lockdown, and we are now just beginning to see that translate through into hospital admissions, which have been falling, and into the overall number of people in hospital, which again in recent days has started to turn the corner and is now falling. And as you can see, stood in English hospitals at 13,772 yesterday. Now, beneath this, there is some regional variation in the northeast and the northwest, where infection rates have been falling from a high base. We have similarly seen early falls in the number of people in hospital. In the south of the country, where infection rates have been lower but increasing, we are only just beginning to see some effects of the lockdown. But it will be the next week or two as we see those full effects translate through. But of course, what's crucial is that we see hospital admissions and hospital inpatients falling. We're going into winter, the NHS's busiest time. We are continuing all the elective work that we do and trying to catch up on the backlog that was caused by the pandemic over the spring. So it's crucial that we don't have so many patients in our hospitals that we cannot do that work. And that's why it's important that numbers continue to fall, and of course that's why it's important that infection rates fall. So we do need to see the further effects of the measures that we all have to follow, and of course everybody in the NHS is extremely grateful that the public is complying with those measures, because that is how we can all support the NHS in its work. Secretary of State.
Thank you very much, Professor Powis. The first question by video is from Ella in Southampton. Ella.
When the tier system begins this week, what are the rules regarding social distancing in an established relationship in a tier 2 area? My boyfriend and I are in a long-term relationship, but we live in separate households, so we're unsure what rules apply to us. Can we see each other indoors, or are we only permitted to see each other outdoors despite being in an established relationship?
Thank you very much, Ella. The rules about exactly what is permitted in each of the tiers is on the gov.uk website, and we're also making sure that it's widely available through advertising. I start my answer with that because for everybody watching, if you're in a specific situation, then the best thing to do is to go and look precisely at the rules. Now, of course, I understand the impact on people who are in a long-term relationship, and we have made specific provision, but the general rule for those who are in tier 2 is that it is the rule of 6 applies outdoors, including, for instance, in a private garden, but indoors you should only be mixing with people who are in your own household. So I hope that answers the question. And I would urge you to go and look on the government website if you've got any query on any of the specific rules in any of the tiers in which you live. The next question from Adrian in Worthing, which has been submitted by text. What provision is there for testing of all students at universities before they return home for Christmas? Well, this is a great time to ask this question, Adrian, because today is the first day that we're rolling out the widespread testing of people who are about to return from university. And we want to make sure that people can come home from university, but do that in the safest possible way. So there's a programme right across universities, right across the UK, to ensure that as many people as possible can get a test before they travel. And this is a really helpful contribution, an example of how the expansion in testing capacity that we've built up over these last 9 months or so can have a real-world impact. And then, of course, there are arrangements in place that if you're at university, your university will be able to give you the details of, for those who test positive, who of course then need to isolate along with their contacts. But that's starting today. Is there anything else that you think we should add? No. So thank you, Adrian. That is the provisions there. And I hope that all students will engage with this enthusiastically, because it's so important for making sure that people can get home safely at the end of this term. The next question is from Hugh Pym from the BBC. Hugh.
Thank you, Secretary of State. Testing for students is voluntary and is not available to every student at every university. So how effective can that programme be? And a question for Steve Powis. How worried is the NHS about a new wave of infections putting real pressure on the NHS in January following the relaxation over Christmas?
Thanks, Hugh. So our approach to testing is that it's voluntary. We haven't made testing mandatory. And maybe I'll bring in General Messenger on this approach with the community testing that we're rolling out as well, with the prospectus that's being launched now. Of course, our goal is to get this testing made available to as many students as possible. It is a huge logistical exercise. I'm very grateful to the universities right across the UK who've engaged with us to help to make this happen. It is about making things as safe as possible. Anybody who has a concern about the need to access testing should in the first instance speak to their university, because we're doing this in partnership with the universities. I think it will make a good difference, a good positive difference, but as I say, we haven't made it mandatory because that brings in all sorts of other considerations, and we think that it is therefore best done on a voluntary basis. General Messenger, and then I'll bring in Steve on the second question.
So obviously a really important part of the community testing programme is to try and drive up participation. The higher numbers that we get tested, then the more effective this regime will be. And we think that the best way to do that is to work with the local communities and the local leaderships, because they're best able to tackle where needs are, where risks are, and they're best able to tailor their offer to the local communities that they serve. So that's right at the heart of this community testing programme, is a partnership that's led from the local level but supported by central help.
Thanks very much. And Steve, on the second question about the new year.
Thank you, Hugh. Well, as I said when I introduced the data slide, it really is important for the NHS that we get infection rates down, and that translates, as it does, into taking pressure off hospitals, reducing the number of admissions, and reducing the number of people in hospital with COVID-19. And that's for a number of reasons, and I'll say them again. Firstly, unlike the spring when we were heading out of winter into the summer, we are now heading into the winter. The NHS is always at its busiest in January, February and into March. We see more infections, chest infections from other viruses and bugs. We see more slips, trips and falls. So the pressure on the NHS builds. So it's crucial going into that period that we have this under control. Again, unlike the spring, we are continuing as full on as we possibly can with all our routine work, our elective work, and we are trying to make sure that we catch up, unfortunately, on the backlog that we had because of the pandemic in the spring. And of course, we've always been open for everybody with emergency conditions, with symptoms for heart attacks, strokes, and we need the public to access the NHS just as they always do. We saw a bit of a drop of that in the spring. We don't want to see that. We want people to come forward. So for all those reasons, it's really critical that we keep infection rates under control. Now, clearly, Christmas is a special time, but the NHS always asks people to be sensible over Christmas, and we're confident again that people will act sensibly once again over Christmas. They will use the change in restrictions sensibly, and we will go into the new year hopefully with infection rates staying down and falling, and therefore the pressure coming off the NHS at that critical time of year.
Thanks, Hugh. Next question is from Emily Morgan at ITV. Emily.
Thank you, Secretary of State. I've got a question about mass testing. I just wonder how you expect to have the same success you had in Liverpool if you're not going to give the councils the same sort of resources. Coventry Council have told us that they feel like they've simply been left to try and work this out themselves, and it will cost them £1 million. Will they get that sort of money to be able to do the community testing you want them to be able to do?
Well, yes, in the prospectus that we're publishing right now, it includes extra funding for local authorities to do this testing, up to a figure of £14 per test done. So that's quite significant extra funding that's available across the UK for councils that want to make this work on the model of Liverpool. And I'll ask General Messenger to set out more details of how we can make it work, because this community testing approach is so important to finding the cases that we haven't yet found, and so reducing the number of infections, which obviously is critical for everybody.
So firstly, we're trying to move away from the term mass testing. I think this is about community testing. It's about tailoring it to the needs, as I said, of the local area, and that might be geographically specific, or it might be ethnic community specific. And I think the Secretary of State's right when he says the prospectus, which will be public from now, will set out a great deal of support and a great deal of signposting for what is on offer to these local authorities. And one could easily see an arrangement where we're setting up some small, local, targeted community testing sites. But equally, when a community wants to target broader swathes of the population, something larger, something more sort of ubiquitous, tackling larger swathes of the population. It really depends on where the need is, and will be driven by the local leadership and the local directors of public health. It's important to talk about the workforce here, I think, because, as you rightly point out, Liverpool was delivered primarily by a military workforce. And I'm not speaking as part of the Ministry of Defence. I work for the Health Secretary on the community testing programme, but I can say with confidence that that cannot be replicated around the country, and therefore the military support, along with all other central support, has to be targeted where it's needed most and where it can have the greatest effect. So I have absolutely no doubt that the military will continue to play a really important part in the community testing programme, but the baseline assumption in terms of workforce generation is that that will be delivered locally with considerable support from the centre. And from what I've seen of a number of local communities, there's great ingenuity already underway in delivering that workforce. They're accessing the volunteer force, they're working very innovatively with the private sector, and yes, of course, they've got good liaison with local leadership in the military. So that is our starting assumption. As I say, I have no doubt that the military will play a prominent role, but the idea that it can be a wholesale offer to all local authorities is simply undeliverable given what the military are doing already.
Thanks very much. Andy Bell from Channel 5. Andy.
Hi, Secretary of State, thank you very much. Realistically, is there any chance of any part of England being able to move down a tier this side of Christmas? There's meant to be a review in a couple of weeks' time. Isn't it much more likely that anyway we'll have to wait until well into January for any chance of moving down a tier, because we'll have to work out what the effect of the Christmas relaxation has been?
Not necessarily, no. We'll look at the data on the 16th of December, and we'll announce the results of that review on the 17th of December. Of course, we've got to take into account that Christmas is coming up, but nevertheless, with the case rates coming down as they are, as I said, coming down by almost a third in the last week, then we will be absolutely looking at each area and seeing what is the right tier for that area. I want to see areas that have pulled together, followed the rules, got the case rate down, like Liverpool has over the last month, which has led to it going into tier 2. I want to see that happening much more broadly. There are some areas of the country that I'm worried about. There are some parts of the country, small parts of the country, where the numbers are still going up. So we do have to be careful and we have to be cautious. But the first review will be on the 16th of December. We'll look at the whole of England at that point, and then we'll continue to review regularly after that. Thanks very much. Next question is from Jim Pickard at the FT. Jim.
Secretary of State, you say today that there's nearly 16,000 people in hospital with COVID. Can you say what proportion of those are in hospital because of COVID, as opposed to people who are in hospital for other underlying reasons such as cancer, or they've broken a leg and they happen to have COVID and that's been picked up? And also, Nadhim Zahawi, the new vaccine minister, has suggested that people who refuse to get vaccinated could be not allowed to visit restaurants, bars, cinemas and so on. Is that kind of stick approach something that you agree with?
Thanks very much. Well, I'll ask Steve to answer the first one, and then I'll answer the second question. Steve.
Yeah, so the vast majority of people, when we have a pandemic and the infection rates are high, are in because of the direct effects of COVID. We do see people in hospital with COVID when infection rates are high who have not been admitted because of COVID. So as the Secretary of State highlighted, about a third of people have COVID without any symptoms. So we have for some time in the NHS been testing everybody who gets admitted for COVID to pick up whether they have it or not. And of course, as infection rates increase in the community, then the chance of picking up asymptomatic individuals as they come into hospital increases. So we certainly do see cases of individuals who've come into hospital without COVID who then test positive. And that's why we've got very detailed infection prevention and control measures in. We not only test people when they arrive in hospital, we test people after they've been in hospital for a few days, because it is also possible that when you arrive, you may test negative. So we're very careful to ensure that we're testing people on a regular basis in their first week in hospital, because that keeps patients safe, it keeps staff safe. But the important thing, of course, as I always say, is to get infection rates down, because the lower the rate in the community, the less the chance is that you will be admitted into hospital for some other condition and turn out to test positive for COVID.
And on vaccines, look, our overall approach on the vaccines is firstly that we do not plan to mandate the vaccine. We think that by encouraging the uptake of the vaccine, we will get a very high proportion of people in this country to take up the vaccine, because of course it protects you, but it also helps to protect your loved ones and your community. On the question of what happens once you've had the vaccine, now, of course, in the first instance, we do not yet have reliable data on whether a vaccine not only protects you, which we do have a high degree of confidence, subject to the MHRA that I was talking about in my comments. We do have a high degree of confidence that the 3 vaccines so far protect the person who's been vaccinated, but the impact on whether you transmit the virus is not as clear from the data so far, and therefore, in the first instance, our approach will be to watch the indicators that we watch all of the time, the case rate amongst the over 60s, and the positivity rate, and to see the impact of that on the vaccine and the vaccine program on the pandemic. Now, having said that, for a long time now, we've been looking at the questions that Minister Zahawi was talking about, and the question of what's the impact on the individual in terms of what they can do. And I've talked about that at press conferences like these months and months ago. And so that's what Minister Zahawi was referring to. He is a great appointment, and I think will bring a huge amount of support and scrutiny to the rollout of the vaccine. I think he's going to do a brilliant job. He's already been working on the vaccine on the business department side of the fence, and I'm really delighted that he's joined the department today. Next question is from Kate Pickles at the Daily Mail.
Thank you. We have heard concerns from the Faculty of Public Health about the enormous resources required for mass testing and the suggestion that it could detract from the vaccine programme. Firstly, I wondered how you'd respond to that and how confident you are that the two things can successfully run alongside one another. Secondly, is the expansion of community testing an admission that test and trace hasn't worked as well as you would have liked? And how can you envisage test and trace changing as a result of this new programme?
Thanks very much. Well, I can reassure you on both counts. The first thing is that the community testing programme is a big expansion of what we can do within NHS Test and Trace. And it's only because of the work of NHS Test and Trace over the last 9 months, the work of the team that has got these massive new testing capabilities that allow us to make these expansions. So that work has been, the work of NHS Test and Trace has been absolutely critical in getting us to this point when we can roll out such widespread use of the tests, for instance, today to university students, and then, as General Messenger was saying, more broadly to the community working with local directors of public health. On the first part of the question, the key point is that testing and vaccination need to run alongside each other. And this has already been happening. For instance, in the vaccine trials, we also tested repeatedly some of the people within the trials to find out if they picked up COVID. And that's one of the ways that you can find out if a vaccine can work. And especially because once you've taken a vaccine, it still takes some time to get immunity through the vaccine, not least because you have to have 2 doses, that it's critical that we have the testing programme running alongside the vaccine programme, and so they are designed to be symbiotic. I'll ask General Messenger to say a little bit more about this, but the last thing I'll say on it is this. The rollout that we can announce today of the community testing programme is a sign of the success of NHS Test and Trace in delivering the massive capability that we now have to be able to keep more people safe and to find this virus and to get it under control with the minimal negative impact on people's lives that all of these things have. General Messenger.
Well, I'm all of 3 weeks in, but my experience thus far absolutely supports what the Secretary of State says. The importance of alignment with what Test and Trace have achieved so far, the vital nature of the alignment with the vaccine. We have to ensure that those are synchronous and not competitive. I can tell you how supportive colleagues have been in the vaccine task force and the Test and Trace. Their experience, their skills, their knowledge has been vital as we've looked to build this community testing proposal. So to me, that alignment is there, but we're absolutely certain that we cannot allow each other to disrupt or deflect from the important business we're all doing.
Thanks very much, Kate. The final question is from David Hughes at the PA. David.
Secretary of State, tomorrow MPs will vote on these new tiers arrangements. The impact assessment the government has published today makes clear that without restrictions, the NHS could be overwhelmed. Given that, are your colleagues on the Tory benches who are thinking of voting against these measures acting irresponsibly? And for General Messenger, 23 million people will be going into Tier 3 this week. What sort of proportion of those people would you expect your community testing exercise to cover?
Thanks very much, David. Well, I would urge all MPs right across the House to vote for the tiered system. The tiered system has a lower set of restrictions than the national lockdown in all 3 tiers, but it's also more targeted so that the areas where the prevalence is lower and the pressure on the NHS is lower have fewer restrictions, which means that people can do more in terms of going about their normal lives, and obviously has a less detrimental impact on the economy. Unfortunately, though, we do have to have the higher tier restrictions, and in particular Tier 3 restrictions in place, so that we can have confidence that we can keep getting this virus down and then keep it under control right across the country. And that way, it is the best way to avoid a third lockdown, and it is the most proportionate way to take the action that we need to keep people safe and to stop the NHS being overwhelmed. So I hope that we get a very significant proportion of MPs from all parties voting for the proposals that we'll put before tomorrow. I don't know, Professor Powers, if you've got anything to add from the NHS side, and then I'll ask General Messenger to answer the second question.
No, simply to reiterate the importance as the NHS goes into its busiest time of year to ensure that infection rates are low and are falling, because as sure as night follows day, that is 2 weeks later, unfortunately, more hospital admissions, more people in hospital, more pressure on NHS services, and of course, unfortunately, more deaths. And increasingly, as we understand conditions such as long COVID, more long-term health problems for people. So the key, as always, is to get infection rates down and to ensure that they continue to stay down.
Thanks very much. General Messenger.
David, I don't know how many of those 23 million we'll be able to reach, because planning is still very much underway. And as I said, the nature of this will vary from region to region and from area to area. We're alive to the possibility that we will not be able to do this all at once, but we assess that local authorities are at varying levels of preparedness and readiness to do this, and therefore I can see this as an offer that will sequence over time and into January and beyond. The priority that we accord, the levels of support we give, will be based on the infection rate, how long those areas have been under harsh restrictions, how mature their plans are, how ready they are to deliver them. And that's the business of the next week or so, is to try and identify some front runners and to lean into support of them so we can have a quick early impact. But as I say, I can see this being sequenced over time.
Thanks very much. The only thing I'd add to that is that I'd urge all those council leaders, directors of public health, and those in the devolved administrations who want to take up this offer that's set out in the prospectus, those within the Tier 3 areas in England and the DAs with whom we've been working, to come forward with their proposals. Often they know their communities best, and so we want to work hand in glove with local directors of public health, with local authorities, and of course with colleagues and MPs who represent those areas, to make sure that we can use this community testing programme as effectively as possible to root out this virus, and also then, hopefully, to free up people to be able to do some of the things that we love. And that way, we can better get through this together. Thanks very much indeed. That ends today's coronavirus briefing from number 10 Downing Street.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.